Okay, it looks like it says we're recording.
Yep, we're recording. So welcome everyone to Elsa Lundy's presentation on food access in Cook County during the COVID-19 pandemic. Elsa has been serving within the Emergency Operations Center of Cook County over the summer of 2020 to help us learn more about what food access looks like during the COVID-19 pandemic, and also to support on-the-ground efforts in the community to distribute food and also create garden programs that will create more long-term food access for community members. So she will be sharing with the group what she learned, and very excited to have been able to work with her this summer. So why don't you take it away, Elsa, and thank you so much again for your service over the summer.
Well, thank you, Grace, and thank you for the intro. Yep, this is actually my last day. This is my final presentation, so I'm super excited to share everything. And as she said, it's on food access, and all the data was collected the summer of 2020 this summer. So first, a little about me. I am currently attending Gustavus Adolphus College, and I have declared my major in biochemistry. I'm hoping to have an environmental and sustainability, climate change focused career path. Don't know exactly what that's going to look like. And the additional AmeriCorps work is basically what Grace just ran through. I've been doing a lot of on-the-ground volunteering aside from this project, and that's including assisting GES, Ruby's Pantry, and food distribution events. So first, the layout of this presentation. I'm going to go over my references right away, and then I'm going to go over the common themes among producers, distributors, and food access programs, an overall summary and looking ahead, and then my references once again. Oh, okay, so first, references. For the producers, I talked to Creaking Tree Farm and Good Nature Farm. And for distributors, I was only able to get in contact with the Cook County Whole Foods Co-op. For food access programs, I talked to Public Health and Human Services Intake, Income Maintenance, Women, Infants, and Children, WIC, and WIC is provides federal grants to states for supplemental food, healthcare, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and also to infants and children up to the age of 5 who are found to be at nutritional risk. Next is the Snack Pack program. The Snack Pack program is a year-long program run by Diane Booth. She continues to run it through the summer, which is unusual for these types of programs, in which she switches to a monthly large box. And any family who is eligible for free and reduced lunch is eligible for the Snack Pack program. Next, we have Ruby's Pantry, and they gather various food overages, surpluses, and bumper crops into generous food bundles for a low $20 contribution. Next is the Hub, and finally, the Food Shelf. So first are our producers, and some of the positive trends we've seen is an increased interest in local food. They've also shown increased sales to the co-op and increased CSA shares. The Good Nature Farm has shown 22 last year to 30 this year, and there have been no excess food due to the demand and the support from the community. Some of the negative trends is there has been a decrease in purchases due to the closing of the farmers market, and the grocery stores offer a lower price than the farmers market. So when the farmers market closed, the farms had to supplement what they normally sold there. So the Good Nature Farm supplemented it by increasing their sales to the co-op, which caused a lower price. And the Creaking Tree Farm did an online market and increased CSA shares. And their online market sells out every week, which is really great. But a downside of doing more CSA shares is that there are more supplies being purchased due to COVID-19 to keep the contact low, and that includes bins, masks, and gloves. And the farmers market was also an outlet for the extra produce made for CSA shares. When a farm commits to doing CSA shares, they have extra produce just in case something happens to a set of crops. And normally, whatever their excess is, the farmers market was an outlet for that. But as I said, they have supplemented it in various ways, but overall, the large change was due to the closing of the farmers market. Next, we have distributors, and this is the co-op. So they have seen more perishables being sold, specifically produce and dairy, and the demand is high for large quantities and bulk items, specifically flour and rice. And the distributors are having to limit some of the items that are in shortage, such as toilet paper, canned beans, any packaged rice, bulk rice, and use is also difficult for them to get. The sales in the deli foods and in-house produced foods declined initially, but they're now picking up again, and they have seen no rapid price changes, and that is of late June. Also, the customers are purchasing in larger quantities and shopping fewer times a week. Next is food access programs. So in Cook County, we have two types of food access programs. We have federal food access programs and community. So federal food access programs are federally funded and managed, and they provide financial assistance in purchasing food products. Community food access programs receive funding from a variety of sources, including grants and private donations, and they are managed on a local level. Some of the common trends we've seen among these is increased numbers in most community food access programs, all but one. Staffing and volunteer numbers are low, and the cost of running the program are increasing. So federal food access programs. Some of the positive trends. Since increased benefits, and this is the SNAP benefits, the unemployment, and the stimulus checks, PHHS has not had a lot of food-related calls, and the short-term food cards have not been requested. They have not gotten any calls from people worried about the increased benefits ending, but this may change as they end. And in the WIC program, there's been no changes in enrollment in Cook County or as breastfeeding rates over the last half year. This is a great statistic because across the state, the numbers are decreasing, and yet Cook counties are staying steady, so that's great. And also the breastfeeding moms are expressing relief that they don't have to worry about formula supply chains. And they've also showed increased interest in learning about the immune benefits of breastfeeding. Some of the negative trends is that there have been increased mental health concerns and calls, and the constant policy change makes it difficult for income maintenance to advise their clients. Next is community food access programs. So Ruby's Pantry shares have gone up but peaked in April. As you can see in the graph of the middle of the screen, it is the Ruby's Pantry shares in Cook County from 2017 to 2020. So the blue line is 2020, and it did peak in April and has slowed off, but it's still at an all-time high. Also, they're getting a better variety of food during the pandemic. This could be for a variety of reasons. There was a new position made to acquire, to find different sources for Ruby's Pantry in Cook County, because earlier in the year, we were in the end of 2019 as well, we were getting a lot more junk food, not the greatest supplies. So a new position was created, and also the pandemic hit, and there's a bunch of other, not all of the sites are open, the Ruby's Pantry distribution sites. So there's a variety of reasons why the food could be better. We'll see as things change what the reasons for that were. Next is the snack pack numbers have increased. Diane normally sees anywhere from 19 to 49, and she's up to 63, and that number is increasing. There's been increased Meals on Wheels and the senior dine-in, which is now the senior takeout meals, from 565 in May to 667 in June. The food shelf numbers are down, and that could be for a variety of reasons. One of the good reasons is that families have more money to buy food due to the increased benefits. One of the not good reasons is those that are 65 plus have showed concern in coming into town, coming to the food shelf with COVID contact. The AEOA has grants to do distribution across Cook County. On July 15th, that was an AEOA and Second Harvest distribution, CFAP, which is Coronavirus Food Assistance Program. And there's going to be another one on the 26th of August. And some of the negative trends. Ruby's Pantry is struggling themselves. They have had to lay some people off in the overall organization, but they are still managing to do the monthly program in Cook County, which is great. The staff and volunteers are at an all-time low for Ruby's Pantry, the food shelf, Meals on Wheels, and senior dining. And also, Meals on Wheels and senior dining their donations have been down, and the cost of food have risen. And not only the cost of food itself, but the cost of the senior dining program going to senior takeout and the takeout boxes is increasing the cost. Finally, the food shelf initially couldn't order a case of anything. They were having a lot of issues with getting food and supplies for the food shelf. And just as it says, just no more than 5 or 6 cans or packages. But as the pandemic has moved forward, they've been able to get food, but now their numbers are lower. So they've had a lot of back and forth there. All right, we're to our overall summary. So the positive trends. The community members have successfully accessed food in this time, which is great. Great to see, great to hear. And the numbers for food access programs have increased. As I said, all but the food shelf, the numbers have been going up and continue to go up. And the challenge is that the food and the food programs are more expensive and are having higher costs, while at the same time, they're low in staffing and volunteers. To keep an eye on going forward, as the additional COVID-19 benefits change and shift, that will shift how people buy food, and it's important that we keep an eye on this and be ready for large changes. Also, Public Health and Human Services is concerned about what will happen with COVID during the cold and flu season, as many people will be out of work and they will need access to food. And then finally, we would love to hear from members of the community on what is working and what is not working, and that's something that we hope to do in the future. So here are my references again. I would love to hear any questions, any comments.
Elsa, this is Andrea. I have a question. Have you, do you have any information on food access programs that maybe are not geared towards large families? Like, so I've been working with Ruby's Pantry to distribute those gift certificates. And some of the feedback that I've received on that and the AEOA distribution is they're not geared for single individual households, and that, you know, it's really just too much food for 1 or 2 people. So there seems to be a gap in community resources, I guess, besides the food shelf, for people who don't need, you know, 65 pounds of food at one time or don't have space for that.
Yeah, so actually I've talked to Bob that's here from Ruby's Pantry, and they have adjusted that slightly as we have more of a elderly population and smaller families. So normally, like, you would get like 5 gallons of milk, and they've cut that number down. So Ruby's has tried to do what they can to make it more manageable for small families. I don't know about any other food access programs, but I do know that Ruby's Pantry is trying to accommodate that, and they have been able to reduce and make it better, but I don't know if it's perfect. I don't know if it could
right, be. Yeah.
Yeah.
Who's going for perfect? Okay, thanks.
Elsa, one of the things you and I had talked about with AEOA was that shelf-stable meal distribution, and that seems like it. Well, again, I mean, they give you shelf-stable meals for 14 days, but if it were, maybe you could order for just one person. That's something we could look into going forward, especially as cold and flu season comes.
Yeah, you're right. That is another great opportunity because the storage for that is a lot easier because it's not in freezers and fridges.
Yeah.
So, okay, yeah.
Elsa, I'd just like to give a little perspective on volunteer reduction. In Ruby's Pantry, I don't remember the exact number anymore, but something like 70% of my volunteers were over age 60. And we're not encouraging volunteers at risk to come and volunteer. And so that's made a pretty big hit on our number of volunteers. We've been getting some good backfill with some new volunteers now, but that was one of the main reasons our volunteer numbers went down.
Gotcha. Thank you. Thank you for that feedback.
It's Andrea again. Is it okay if I ask other people on the call a question? Is that weird? I was just going to ask if, Frankie, if you had any perspective on community food access for smaller households.
What are you thinking about, Andrea? Follow your question.
Oh, okay. I was wondering if you had any perspective on community food access programs for smaller households. Like, somebody who maybe is an individual or just two people who would not benefit from Ruby's Pantry or those AEOA distributions?
Well, you know, that is a problem, like Ruby's Pantry. It's not something that a person living alone can go to because it's just way too much food.
Right. Do you have any thoughts on how we could fill that gap? Not to put you on the spot. Well, you think about it. If you think of anything, you let me know.
Andrea, Elsa, you had mentioned that there had been concerns about coming into the food shelf. And I don't think there's someone on from the food shelf right now, but I wonder if we could do something where we would use like the volunteers with care partners, for example, that were saying they'd be able to do like grocery, help with grocery shopping to deliver food from the food pantry from the food shelf. That way people wouldn't have to come in. Oh, Andrea, you're muted.
I know, I was looking around. He's looking for milk and toast, so now I forgot what I was gonna say.
Oh, I was gonna say, I was asking about using maybe the care partners volunteers from the grocery project to get food from the food shelf to individuals who aren't feeling comfortable going out of their homes.
Yeah, I know that there are a couple people around town who do food shelf pickups for other people and take them, to, I guess, probably their friends and stuff. So I know that there's some of that happening, but if, I've been meaning to get over to the food shelf when it's open for like, I don't know, probably the whole time Elsa's been working with us. And I just haven't made it. So I could connect with Gwen and see, how I can help expand the resources. So I will, I'll add that to my running list here that I got for this call.
Brian, I see you're on the call as well. So Brian Bloom works with the statewide health improvement plan throughout Northeast Minnesota. Brian, I'm wondering if what we've found with Elsa's work this summer relates to what you're seeing in other parts of Northeast Minnesota right now.
Hi, this is Brian. I think so. I definitely know I've heard from other regions or places around the region that the food boxes are just like way too big. And that's what I've been thinking about for the past like 5 minutes or so. If there's a way that we could set up the system per drop-off site to collect food that is either like to repackage the boxes so they're smaller and maybe have a different system for single people or people who don't think they could eat as much. So I think that's probably going to be one of our next steps, and that brings about a whole other bunch of questions. We'll need more volunteers and space to store things. So I think that's probably our next hurdle.
Yeah, to comment on that, Diane Booth with the Snack Pack program, she's gotten produce boxes and she splits them up amongst her families. So she is doing something like that for her Snack Pack program, just, making it more of a manageable amount. So.
I'm thinking about the suggestion of having care partners deliver from the food shelf. In my situation right now, I don't want to go out and I use a walker to get around. So I can order my groceries from Johnson's and they deliver it right to my door, and that's fine for me. But if I couldn't afford to do that, I'd have a real problem. So I'm thinking there's probably elderly people that need food from the food shelf, that can't really get it. So wouldn't that be great to have some kind of transportation for them?
Yeah, I think that that would be really great.
I'm also thinking about the volunteer issue, and I'm wondering within Cook County, other cities around the region have maybe a community college or university that they could tap into, but that's not the case in Cook County, except for that, I'm forgetting exactly, it's like Cook County Higher Ed, and I don't know exactly how that functions, but could that be tapped into as a source of recruiting volunteers? Or maybe it has already, and I'm not aware of it.
You know, I'm not sure. I feel like they would probably be a good resource to share the volunteer information, but I don't know that it would, yeah, higher ed doesn't really obviously function the same as like a community college or something, but it's an interesting idea. I will make note of that.
Brian, I'm also thinking, so Elsa, as a Cook County High School graduate, has graciously connected me with the teachers who organize student council. And one of my goals for this year is to find a way to do more youth engagement with our public health efforts in general. And that is just starting, because we've been kind of, until last night when the school board voted to start the year with distance learning, everyone's just been focused on what the school year will look like. But now that that decision's been made, maybe it's a good time to start to revisit how student council would look, and if they'd be interested in working with public health. That could be a group that might get the word out about volunteering opportunities.
Yeah, also to add on to that, when I was in high school, the National Honor Society, we did different events like that. Like every year we did on Halloween, we collected food for the food shelf, trick or can. So we'd walk around and collect stuff. So they might also be a volunteer base, the National Honor Society. So.
That's a good thought. I'm looking forward to building stronger relationships with the high school aged youth in Cook County. I think that'll be beneficial for a number of different things. And just, you know, thinking about this Elsa's Trim of Service and this focus on food access is part of our Emergency Operations Center, which is the entity that is responding to the pandemic within the county. And I think involving youth in that is definitely not, it's something we could improve. So
I also wonder too if that could help. We'd have to be really careful about this, but maybe address some of the ongoing and increasing issues of isolation. I don't know how we deal with the social distancing aspect of things, and maybe we don't want to get into it, but it would definitely help to have people delivering meals and then offering that human contact, even if it is a distance thing.
Yeah, I think that's true. And I also think if you circle that back to what Grace just said about the local youth, it might be, you know, if the high school students are not actually in school, you know, they might be looking for something that they could do together but distanced, you know. So maybe some of those volunteer opportunities would serve as that sort of socially distanced social time, physically distant social time, sorry.
Yeah, just for a point of view, we had quite a few high school students in April, but then summer jobs appeared and we lost a lot of our high school volunteers. So we have this odd demographic where if you're, you know, young enough to help but old enough to help, you probably got a job and can't help.
I wonder if that will change going into fall and winter. I mean, I know people still have jobs in the fall and winter, but with the tourist season winding down, I wonder if it'll be more like April again. I guess
I think a lot of kids will be looking for stuff to put on their transcripts and put on their applications for extracurriculars. So I think that food access and helping the elderly, helping these programs would be really great. I think that will be really appealing to a lot of students.
That's a really good point. I think that if we sort of word it like that as, you know, food access and community support programs that they can put on their, you know, their experience list would be, yeah, thanks.
I have a question about Meals on Wheels. It looks like you have a big number of people getting advantage of that right now. Do the individuals pay for that service, or is it a free service?
That is a paid service. I believe it's $4.70 per meal for 65 plus, and then $7 if you're under 65, but that is a paid service.
Do you know, do they have like financial scholarships available for that or anything over there?
I am unaware. I do not know, but I'm guessing there's some sort of financial support, but I am unaware of it.
Yeah, I just wonder, my mom is utilizes the Meals on Wheels program where she lives, and every month I get a bill from them, but they stress that if you can't pay it, don't pay it.
Gotcha.
Because they want her, you know, they want people to have the food, but if you can pay for it, obviously it helps sustain the program. So I wonder if the hub has something like that. Write it down. I got a long list already. Thanks, Elsa.
You're welcome.
I'll also mention, for those of you who don't know Andrea, Andrea also works with the statewide health improvement program here locally through Sawtooth Mountain Clinic. So she's the person who will be, among others, will be able to continue some of this work, since the statewide health improvement program stresses access to healthy food as one of its priority areas. So it's really nice, since Elsa's been able to be here for the summer and to give us extra capacity to get a better grounding in what things look like here, but we're not, you know, we don't need to have this kind of go by the wayside. We're able to take what she's learned and through Andrea's work and through other relationships we're building in the community, hopefully move this forward and not let this kind of just sit on the shelf as the findings that she's come up with through the summer. So that's great.
Yeah, I was serious. I'm really excited. So thank you, Elsa. This is a great jumping off point.
I'm glad I could help.
And we're glad you did help.
Yeah, actually, I just found out, I got an email at 1 o'clock today that they're pushing back my going back to college for me. So I will be at the next Ruby's Pantry helping out, because I will still be here. So, yep.
And Elsa also wrote a fantastic article for the News Herald, and it was slotted to be in today's edition. And Elsa, I did find out it so that they somehow, I won't get into the full background here, but it did not get in today's edition, and it will be in next Friday's version of the paper. So it seems like they went down from 18 to 16 pages, and that was one of the things that fell off. And
Gotcha.
So Brian at the News Herald apologized and assured me that it would be in next week's copy of the paper. So be sure to look for that. It's a fantastic article. It goes over some of the information that Elsa shared today, and she also put together a brochure with her findings that I can, I know I know some of your email addresses, but if you want to put your email in the chat box, I'll make sure that you get a copy. I think Jim, I'm not sure which Jim is listening in, but you might be the only one who I don't have an email address for.
It is up on Boreal.
Oh, great.
Okay. Yep.
All right.
Yeah, Grace, you have my email, Jim Weenanen.
Oh, okay. I wasn't sure. It could have been Jim Weenanen or Jim Boyd or another Jim. So I do have your email, Jim. So no need to put it in the chat box. I'm glad you're able to do the presentation.
Oh, this is great. I wasn't sure how this was all going to play out at the beginning, but it's really been good to have Elsa kind of pursue this part of our food access in the county. And I've enjoyed being a part of Ruby's Pantry now for a year plus, excluding a medical episode. And with regard to the large boxes or large amount of food for single persons, in my case, I've tried to plan ahead with either neighbors or my family to kind of share what I would take home. So I almost have it manageable.
That's great.
Hey, Ryan, do you think it would be appropriate for me to share that AmeriCorps YMCA link that was shared in the ERI meeting yesterday with this group?
Are you talking about the Zeitgeist graphic for Duluth?
Yeah, the infographic.
Yeah, go for it.
Okay. Let me throw it up here. So this is the infographic that True North AmeriCorps put together. I believe they said it was still in a working draft, but the link will stay the same. It has the 2019-2020 service year impact report and then a COVID-19 impact report on it. It's interesting to see.
I can go ahead and share the screen of it as well. So this is so AmeriCorps is similar to the Peace Corps. It's a national community service program. And this emergency response initiative was specific to supporting response activities from the COVID-19 pandemic. So I am so glad that they offered that and that the stars aligned so that we applied to be a host site, and that Elsa applied and came to work with or to serve over the course of the summer. So this is some of what different people have done for their service over the summer. And I can go ahead when I send that brochure from Elsa, I'll go ahead and also include this link so that you can see what the impact of this program has been throughout the state. And I guess this is just the region, actually. I know that there have been some people serving in sites in the Twin Cities as well, but the one that the Duluth area YMCA focused, the True North AmeriCorps, that emergency response initiative chapter has just been in the Northeast. So way to go. That's quite a few people. Good job, Elsa.
Thanks. Yeah, it's crazy to see these numbers and like being a part of it just because there's a lot of effect from it. So
Absolutely. Well, I'm going to give one more opportunity for questions or comments, and then I'm going to be closing things out. So any other questions or comments for Elsa and for her work over the summer?
I'm just going to say thanks again.
just going to say a job very professionally done. Well done, Elsa.
Thank you.
I echo that. We've been so fortunate to have you here this summer. So I'm just hoping our paths will cross again, and best of luck for your return to Gustavus.
Thank you. Thank you. Yep. Hopefully I go back.
Yeah. All right. Well, take care, everyone. Have a good afternoon.
Thank you for your time, everyone. Bye-bye.